In this video, we're going to talk about when it's not safe to perform manual lymphatic drainage. So there are two categories: absolutely not safe to perform manual lymphatic drainage and relatively not safe to perform manual lymphatic drainage. In the absolutely not safe category, we have 6 conditions, and if you have any one of these, you do not want to do manual lymphatic drainage. Number 1, malignant disease. So when we say malignant disease, that covers a wide variety of cancers. Now, stimulating the lymphatic system and stimulating the flow of lymph could potentially spread malignant cells, and this is not something desirable for our immune system. So we want to definitely not do manual lymphatic drainage under these circumstances. Number 2, acute inflammation. In cases of acute infection or acute inflammation, increasing the flow of lymph could spread the infection or worsen the inflammation. So it's not ideal to perform lymphatic drainage under these circumstances. Number 3, severe allergic reaction. What accompanies a severe allergic reaction is swelling, inflammation. If we stimulate the lymphatic flow, this could exacerbate the reaction, and this is not something that is ideal. So we want to be cautious and not employ any manual lymphatic drainage. Number 4, deep vein thrombosis. Now I have to emphasize, manual lymphatic drainage could stimulate and dislodge a blood clot, causing a life-threatening reaction like a pulmonary embolism, essentially a blood clot. So definitely lymphatic drainage is an absolute no-no. Number 5, cardiac insufficiency. Now, people with a heart issue may not be able to tolerate any type of increased flow of blood, lymph that can overload the heart. So definitely we do not want to do any type of manual lymphatic drainage. Number 6, a seroma. A seroma is a collection of fluid that's trapped. So of course, we don't want to increase any type of flow to this area because it's just going to complicate an issue that's already complicated. Now let's cover relatively not safe conditions that could be safe, but with careful consideration and consultation of a healthcare professional. We have 5 of these to cover. Number 1, low blood pressure. Now, with manual lymphatic drainage, it could decrease the blood pressure, further predisposing you to fainting or dizziness. The normal range of blood pressure is 120/80. So if that 120 decreases to a 90 and that 80 decreases to a 60, you are definitely in that low blood pressure zone, and we want to approach with caution. Number 2, thyroid disorders. Now, stimulating the lymphatic vessels, particularly around the neck, can alter the hormone levels of the thyroid, particularly not with hypothyroid, but an overacting hyperthyroid conditions, disorders. It can exacerbate and complicate things. So we want to definitely be cautious and seek professional advice from your doctor before proceeding with manual lymphatic drainage. Number 3, high-risk pregnancies. Now, under that umbrella of high-risk pregnancies, there are many conditions, situations, body types, just a slew of things where in some cases, manual lymphatic drainage would be beneficial for some women, and in other cases, it will not. Definitely want to get consultation from your specialist to see if it's indicated or contraindicated. Number 4, bronchial asthma. Now, very rare, but in some cases, when stimulating the lymphatic flow, it could cause respiratory issues. So again, we want to make sure that you're speaking with your specialist to make sure that it's absolutely okay that you can perform manual lymphatic drainage with no issue. Number 5, chronic infection. Now, it's very important that we are carefully evaluating what state we are in with chronic infection, and you're seeking a consultation from a healthcare provider because we do not want to spread the infection. So we can see that manual lymphatic drainage is very beneficial, but safety is the top priority. If you want to know about some of the subclinical conditions that manual lymphatic drainage can treat, watch this video right here.